6 tonight, the average patient at Sutter General overcharged more than 400%. Take a look at the numbers put out by the Union of Healthcare Workers. 1 tab of amoxicillin, that's a common drug used to treat infections, goes for $17.56. A tablet of Ambien, that's a popular sleep aid, $40. Sincere Tonsil explains the efforts to cut down on the markup.
Clipboards in hand, nurses and techs from Sutter hospitals take steps to revamp the way their employer does business.
We don't have a choice. There are lots of times, especially where I work, when you're in a trauma, you don't have a choice about whether you go for health care or not. And then you're faced with crippling financial burden when you're out, and so that's something that we can change.
See that $44.09 price for lotion on this union sign? That's just one of the numbers these folks are taking issue with.
Sutter, they bring prices up up to 400 or 500%. And so they're going to fight us.
SEIU-UHW members are trying to take the pain out of what they see as extreme price gouging by gathering signatures to get the Fair Healthcare Pricing Act of 2012 on the November ballot.
We've already collected 150,000 signatures in 2 weeks.
Those signatures could let voters choose if hospitals should be prohibited from charging more than 25% above the actual price of providing patient care. The other initiative the group's working on, the Charity Care Act of 2012, which would increase the amount of money available to cover services for those who can't pay. For a campaign rooted in the rhetoric of fairness, the State Hospitals Association says these petitioners aren't being very fair themselves. According to Jan Emerson Shea, quote, they're targeting hospitals where unions want to make inroads, unquote.
Also new at 6 tonight.